Hello, we are learning about anti-diabetic medicines. So basically, this is a quick summary of anti-diabetic medicines. Um, so medicines used in diabetes include metformin, which is the only big one. So basically, metformin is thought to increase the glucose uptake in the periphery and the liver, and it also reduces gluconeogenesis, which is the synthesis of new glucose in the liver. Um, Also, pioglitazone is also thought to increase glucose uptake in the periphery and increase insulin sensitivity. So if you look at the biguanide and the metformin and the pioglitazone, they are very similar action. We have also the sodium glucose reuptake transporter 2 inhibitor, which basically inhibits the reabsorption of glucose in the kidney. The sulfonylureas and the meglitinide, which is like rivaglitide and natiglitide. So basically, these increase the secretion of insulin. So they are called insulin secretagogue, or basically medicines which increase the incretion of insulin in the liver. And we have acarbose, basically inhibits the breakdown of sucrose into glucose. So basically, the important thing about acarbose is if someone is having hypoglycemia, they should not take sucrose, as acarbose basically inhibits the breakdown of sucrose. So basically, you have to give pure glucose. The other class is the dipeptidyl peptidase and the glucagon-like peptide 1, which are very similar. Action. So basically, the glucagon-like peptide 1 is basically synthesized in the gastrointestinal tract, especially in the small intestine and the colon, and it basically it's like a hormone which increases the secretion of insulin, reduces the secretion of glucagon, and slows the gastric emptying. So the dipeptidyl peptidase basically is an enzyme which breaks down glucagon-like peptide 1. So basically, if you inhibit the breakdown of this enzyme, so you'll end up with the same result, which decrease glucagon secretion, increased insulin secretion, and reduced gastric emptying, and thus glucose absorption. So basically, the metformin and the pioglitazone have similar mechanism of action. The meglitinide and the sulfonylureas have similar mechanism of action, and dipeptidyl peptidase and glucagon-like peptide 1 have similar mechanism of action. And then we have the sodium glucose transporter inhibitor and the acarbose. So if you look at the common side effects and the contraindications, so basically most of them are contraindicated in lactic acidosis, which is especially important in metformin, which important type of acidosis where um, increased decreased pH caused by lactic acid accumulation in the blood causes um, acidosis in the blood. So basically, they are all contraindicated, whether it's sulfonylurea, metformin, the dipeptidyl peptidase. So most of them. And also, if you come to hepatic renal hypersensitivity, especially the dipeptidyl peptidase and the glucagon-like peptide 1, they cause hypersensitivity, also the renal and hepatic problems. So you need to reduce the dose. You need to look up each medicine. So basically, um, especially the hypersensitivity is the most important. Also, the sulfonylureas. Remember, sulfonylureas are derived from the sulfur drugs, so they cause rare side effects, high granulocytosis, and also hypersensitivity reactions as well. Hypoglycemia is very important with sulfonylureas and the meglitinide, and also the sodium glucose transporter 2. Also, weight gain, which is associated with the sulfurious, the meglitinide, the sodium glucose transporter 2, and the pioglitazone, and also insulin, which we discussed in another video. Also, in pregnancy, only metformin and glibenclamide is used, especially after organogenesis after 11 weeks of pregnancy. And GI problems. So all anti-diabetic medicines cause GI problems like dyspepsia, nausea, diarrhea. But especially it's more significant with metformin and acarbose. Basically, one of the main reasons why people stop taking metformin is problems with abdominal pain or nausea or diarrhea. And acarbose is basically even worse than metformin. Um, when it comes to GI problems. So if you continue, some medicine-specific considerations for metformin, remember renal impairment and the iodine basically the renal impairment is very high risk factor for causing lactic acidosis and also avoidance of or basically temporarily stopping metformin if patients has to have iodine contrast X-ray um, examination. Also, for sodium glucose transporter 2 inhibitors, remember, they cause significant diabetic ketoacidosis. Also, urinary tract infections. Also, avoid in volume depletion. If there's, for example, dehydration or diarrhea or extreme vomiting, um, volume needs to be corrected before the SGL2 are um, prescribed. So also remember they also cause polyuria because if you increase the concentration of the of glucose in the urine, you cause high osmolarity in the urine. So basically, it's no wonder that one of the side effects include polyuria when it comes to pioglitazone. So pioglitazone, remember, there's high risk of hepatic liver toxicity, um, heart failure, bladder cancer, and also one of the side effects include visual disturbance, headache, anemia, dizziness, arthralgia, hyposthenia, hematuria, impotence. So if you look at this mnemonic, it basically has everything: the visual impairment, the impotence, the dizziness, the headache, the arthralgia, so and also edema and dizziness. So if you just look at this mnemonic, you could basically remember all side effects with pioglitazone. Dipeptidyl peptidase, they have GI problems as we discussed earlier. They also cause upper respiratory tract infections and urinary tract infections, peripheral edema and headache. Um, Sulfonylureas, the main consideration is the hypoglycemia and the GI problems, but they have more side effects. Drug interactions, unlike other anti-diabetics, the other anti-diabetics mostly have minor interactions with medicines, but sulfonylureas, as they were derived from sulfur medicines, remember, they interact with NSAIDs, which basically increase the hypoglycemic effect of sulfonylureas. Also, warfarin, rifampicin, some enzyme inhibitors and inducers like chloramphenicol, sulfapyrazine, itraconazole. So remember, if you see sulfonylureas, think NSAID. For example, people who over-medicate with over-the-counter NSAID medicines. And when it comes to glucagon-like peptide 1, like the Victoza or Byetta, the brand names for exenatide, um, and liraglutide. So they cause some GI problems and hypersensitivity, but then a specific is pancreatitis, inflammation of the pancreas, and as we said, GI problems. So remember pancreatitis for GLP-1 medications. So you could look at the P to remember the pancreatitis.